Hello, my name is Evelyn Pineda, and the topic I chose was health and medicine in the community-based organization that I decided to talk about is Partners in Care. Before I dive into the organization history of Partners in Care Foundation, it has been in the business of bringing healthcare families and the community-based services together since it opened in 1997. The founder of the CBO organization is Ms. Joan Simmons. Her quote is, "This is our moment in healthcare history. We were born for this work." Every year, approximately 2.6 seniors are readmitted within 30 days at a cost of over 26 billion every year. To help lower rates of readmittance, they need to improve patient experience and establish cost saving to the Medicare program. This is where Partners in Care Foundation come in. Data shows that 40 to 50% of elders using home or community-based care are using medication inappropriately, leading to a range of preventable issues including falls, 911 calls, ER visits, and hospitalization. HomeMeds utilize a computerized risk assessment and alert process. The Care Transition Intervention provides an in-home visit within 24 to 72 hours with a phone call within 30 days. This is to strengthen of the patient's skills in health self-management. Partner serves older adults, adults with disability, and delicate, fragile adults who require in-home support after hospital discharge or ongoing support to avoid hospitalization. State prescription: more than 300 people in the population that is 65 or older have enrolled in the pharmaceutical assistant contract for the elderly, PACE, if they have an annual less than 23,500 for an individual or 31,500 per couple. PACE was established in 1984 with a strong support. Life expectancy at birth in years according to the race and sex in the U.S. Although Americans are living longer, it shows in the graph that there is more elderly people and there is a demand to help them. Health self-management education participants are offered one of the three programs developed by Stanford University School of Medicine: a 2.5-hour in-person workshop, an online program of health self-management activities, a toolkit containing a workbook to aid the development of skills to self-manage chronic conditions, and a relations and exercise CD. The Partners of Home Network is active in the following counties across California, with further expansion in progress across 4 more counties. In-home preventive care: when the patients understand their treatment and actively participate in their care decisions, the patients are happy and their health improves. What are the goals of the program? To help as many elderly or disabled patients to not get readmitted to the hospitals and to expand their services. The founding sources: the Business Institute is made possible through generous support of the Aging and Disability Business Institute and is funded by hospitals and government funds. The graph of the success of the program: as you see, the blue is not readmitted and the pink is readmitted, so there is a successful rate of this program. Chronic disease self-management: the 2.5-hour workshop, which runs once a week for 6 weeks, addresses the physical, mental, emotional, and social challenges of patients with one or more chronic health conditions such as high blood pressure, arthritis, diabetes, heart disease. Proven to reduce outpatient visit and hospitalization, the program boosts health, nutrition, cognitive symptoms management, physical activity, and overall patient well-being in an interactive group setting. The workshop is also available in Spanish. Tomando control de su salud. The obstacles that Partners in Care have is that sometimes the patient does not meet their personal goals. Sometimes the family is not helpful with the information the social worker needs. The barriers are sometimes a different language is spoken and a need of translator, especially in Korean. Rachel, one of the Partners of Care transition coaches, recently visited Howard, a patient of Ronald Reagan UCLA Medical Center in Beverly Hills. Howard, who lives in the San Fernando Valley, told Rachel if he was having trouble affording the cost to getting to and from his medical appointments, he was spending $50 per ride on taxis. Immediately, Rachel was able to provide easy solution. Her solution was to get him free transportation through City Ride.